Welcome to SBME Interfaces. Our goal with this show is to introduce you to the people that interface with biomedical engineering, from students and faculty to staff and industry, and everyone in between. BME is a broad field that encompasses so many different perspectives, journeys, skill sets, and backgrounds, and we are excited to share them all with you.
We're very excited today to have Dr. Roger Wong with us today. We're interfacing with him as we do with our other guests. He's a clinical professor in Division of Geriatric Medicine. He's a staff clinician at VGH and Providence Health. He completed his undergrad and medical degree at the University of Alberta. He's been Vice Dean of Education at UBC Faculty of Medicine since last year, and previous to that, he held a number of other leadership roles. He's won several awards, including Order of Canada, which is really exciting. He's the founder of the Acute Care for Elders, which is a unit that's been implemented in Vancouver and at other institutions. He's past president of Canadian Geriatric Society. He's avid on social media and also has a very interesting TED Talk that's been viewed numerous times. So welcome,
Roger.
Well, thank you very much. My absolute pleasure to be with you today, and thank you for the kind invitation.
No problem.
Sure. So I wanted to start with how COVID has impacted your work, especially when it comes to things like geriatric care, and even considering maybe some of the, shall we say, flippant sound bites of people in the media surrounding the at-risk portions of our population. So what challenges have you faced throughout the pandemic, and what have you learned over the course of the last year?
Absolutely. Well, we all know that COVID-19 really has affected each and every one of us in a different way. As a geriatric specialist, my work with seniors, and that includes those who live in the community, that includes those who live in long-term care homes. And we all know that seniors are at increased risk for getting the infection with COVID-19, in particular those who live with long-standing health conditions, and in particular those who live in long-term care homes. And all of us have seen really very heartbreaking stories when in particular there are outbreaks of the virus in long-term care homes, both in Canada and around the world. I have to say my work has really increased in a way that I never imagined. I can basically describe the last year or so as kind of myself seeing my entire professional career unfolding in a very short time course. All the things that I worked over my professional career in protecting and supporting seniors, we really have to put every one of those things in place during the COVID-19 pandemic. The other thing that I really have learned is that we know that in geriatrics, we never really treat the older person only. We also have to help support their families, their care partners, their loved ones. And that also has been really something important during the COVID-19 pandemic. I have to say that in the early days, we tried to explain to people what physical distancing means, what does it mean to protect yourself, to protect your loved ones. We very quickly identified that while physical distancing can be helpful to protecting people from the transmission of the virus, it does not mean social isolation. So loneliness and social isolation becomes a really important issue. So we have to figure out ways to help promote social connectivity, something that we can talk about later on as well, because at UBC, we have done something very innovative. But the importance is to stay social, but in a safe way. And then obviously in terms of the long-term care sector, which really has been hard hit, both in terms of the residents who live there and also the people who work there. I have done a lot of work with the Government of Canada. I am a member on the Task Force on Long-Term Care and Health Expert Group that was convened by Dr. Mona Nemer, the Chief Science Advisor. We provide recommendations to the Prime Minister and his cabinet. I've been invited to speak as an expert witness to the Senate of Canada and to make recommendations in terms of how to best protect and support older adults in Canada during the pandemic. So it's been a very, very busy 12 months.
Wow.
I can imagine. So, Roger, taking a step back, can you tell us and the audience in LA what the field of geriatrics is? And secondly, followed up, what made you specialize and go into residency in that, and then that becomes your sort of life career?
Absolutely, Payam. I have to say that geriatrics in general refer to the specialty field whereby we provide the best possible care for older adults and their loved ones, their families, their care partners, and so on. Now, in particular, in my line of work, I've done a lot of work in acute care geriatrics, hospital medicine for older people. I developed the acute care for elders units. First ones in British Columbia. We started the prototype unit in Vancouver. It has subsequently been replicated around the province, around Canada, and also globally. But I've also done a lot of work in the long-term care sector. Interestingly, I've done throughout my professional career a lot of culturally sensitive care for older adults. So, for example, one of the earliest culturally sensitive long-term care home, which is a multi-level care home operated by Success, a not-for-profit organization in British Columbia. I was actually the chief consultant on a voluntary basis, actually helping to design that long-term care home that serves many of our seniors who speak minimal or no English. And therefore, culturally sensitive care is something I've been doing throughout my entire professional career. And I have to say that in Canada, we still have a shortage of geriatrics doctors, whether someone like myself in geriatric medicine or in geriatric psychiatry or care of the elderly, family doctors with enhanced training. So we need a lot more, which is why I'm very thrilled that I'm very humbled and honored to receive the Order of Canada in 2020. It was groundbreaking in a sense because it was the first time ever that a geriatrician is recognized and inducted into the Order of Canada. And I hope that by sharing my story here and elsewhere, I can inspire more of our health professionals to really get into the field of geriatrics. And that clearly includes our biomedical engineers, which we can talk about later on.
Sure. Is there an age limit that quantifies when the geriatric physician sees the patient?
In general, we see older adults over the age of 65. That said, age is only a number because I always look at it as when we talk about aging, it really is individualized. It applies to each and every one of us in a different way. I have to say, when I first chose to get into the field of geriatrics, it really is a nice fit for my own character. I'm someone who always believes in holistic care. To heal means to make whole again. So we make whole again not only in the physical aspect, but also in the mental, functional, and psychosocial aspect, that holistic concept. And in fact, I have to say that when I look back now, and if I were to choose all over again, I would absolutely pick geriatrics all over again, without a question.
Great.
That's amazing. Where in Canada, aside from not having enough doctors to meet the demand, is there any place where you think we're doing well, and any other place where you think we're kind of falling on our face and we should be improving and really looking at that portion of the geriatric population?
Yes, Miguel, thanks for the question. I have to say COVID-19 has really taught us a lot around the world in many different things, but in particular in terms of seniors care, I think what it has revealed in Canada and around the world are some of the things that might be present structurally, but these perhaps shortcomings or things that we can improve on have now become exacerbated. So I have to say in Canada, when I look around the world, there are many things that, as far as care for older adults are concerned, we're in a decent spot. I mean, for example, we have a health system that is operated, based on the Canada Health Act. It really allows us to do a lot of things that in other jurisdictions and other countries that may not be possible. At least we know that care when it is needed, for those who need it the most, we can provide. Now that said, obviously there are opportunities for improvements. Continuous quality improvement is really important. And a prime example is in the long-term care sector. I have to say another area whereby we have done well is that, again, something that we've learned during COVID-19 is everybody really worked together in a very concerted way and very quickly. We pivoted. Everything that we do, we switch over and we do what is absolutely needed. I mean, if you take a look at vaccine development for COVID-19, for example. I mean, interestingly, Canada, and in particular UBC, played a very important role in the development of the vaccines, and that we already have. In Canada, we have approval of 2 vaccines right now, as we know, the Pfizer-BioNTech vaccine and also the Moderna vaccine. And in both of those situations, the carrier molecule actually was developed by a group of researchers here at UBC in the Faculty of Medicine. So it's quite amazing that we are well positioned, we believe in science, and we apply the science that we use to further advance the needs of society. Now that said, obviously, as we are also learning, while the science is working out well, the logistics and the rollout of vaccination is something that we are still working on. And I think that certainly is another area that more effort and energy needs to be invested.
Roger, what to you makes the Faculty of Medicine at UBC special? Especially you have this unique role of vice dean education.
Well, I'm tremendously proud to be working with all of our students and our trainees and learners, as well as our faculty members and staff, because at UBC, the Faculty of Medicine is a province-wide operation. We are a provincially distributed medical school. We have 4 regional campuses. The Vancouver Fraser campus, and you can see the building in my background is the Life Sciences Center in the UBC Vancouver campus. We will also have regional campus in Prince George in the north, in Victoria on Vancouver Island, and in Kelowna in the interior. When we talk about medical residencies, we actually train our resident doctors throughout the entire province. Our family medicine program, the largest in Canada, we train our family doctors of the future in 19 different locations. And in fact, when you look at our health professional programs, our physical therapy program, our occupational therapy program, our speech and audiology program, our genetic counseling program, our midwifery program, and our medical laboratory science program, all of these programs train health professionals to really fulfill and meet the needs of society of British Columbia in the future. This is a huge operation. I'm tremendously proud to be working with all my colleagues. And I have to say, once again, in COVID-19, we have learned that all of our colleagues, our students, our residents, our health professionals, our teachers, our faculty, our staff, we all have pivoted very quickly. I remember March 13, 14, 15, 2020, that weekend, we had to make the tough decision of, basically switching over to blended delivery of our medical and health education programs. And we did that in 3 days. By Monday, Tuesday, Wednesday, 16, 17, 18, we actually implemented. Now, recognizing that this would not be possible without the tremendous help and input of everybody around the province who work with the Faculty of Medicine. And for that, I'm greatly, greatly thankful. And so also recognizing that it was not a perfect solution in the first place. So we are undergoing continuous improvement. But I have to say, I am very much touched by the energy and enthusiasm of everybody. And special shout out to all of our students. Our students have really done a tremendous job, not only dealing with their curriculum material and activity to continue learning, but in addition to that, our students have led many initiatives during COVID-19 in order to support their local communities. And for that, I'm tremendously proud.
Great.
You talk about the ability to pivot and even going back to the development of at the very least some sort of science that fed into vaccines from UBC. how do you see the role of biomedical engineering specifically helping in geriatric care as we move forward? How would you like to see it take a role in that?
Absolutely. I think the key words that I think about in answering the question, really the two words, is social accountability. In fact, in UBC, the Faculty of Medicine, our entire medical school and all the related programs, and both education and research, are built upon that foundation of social accountability. We are here to meet the needs of society in British Columbia. And in that particular kind of lens, I would say that the School of Biomedical Engineering, which is a phenomenal collaboration between the Faculty of Medicine and the Faculty of Applied Sciences, and I think all of us are tremendously fortunate to have this particular opportunity, this collaboration. I really see that our future biomedical engineers are also here to fulfill that social accountability. We are accountable to, as a public university, our people in British Columbia, our government, for providing the resources and the training opportunities. I think in particular in seniors care, there are many opportunities. Let me give you one example. I work with a lot of seniors on healthy aging. So the whole concept of what can we do to age in place, in the places where we live in. And we know that healthy aging does not only mean the biophysical aspect, it also means, the environment that we live in, the technology that we work with, having adequate and clean food supply, water supply, and so on. So I think there are so many opportunities for biomedical engineers to work alongside with the rest of the team. I believe, my favorite math equation I often talk about, and I'm not going to talk about calculus today, but I actually think about 1 equals 0. So one person really, individual effort really doesn't go very far. So I think as part of that team, biomedical engineers plays a very important role. Whether it is about, talking about wearable devices, whether it is about devices that can help us improve the environment to reduce the likelihood of people tripping and falling, for example. We know that accidents are the most common cause of falling amongst older adults, and accidental falls are preventable. And there are many things that we do, but one of the things is how do we improve the environment in the household, for example. We know that we now can actually put devices, sensors on the flooring that in the event that someone actually does fall, you can capture the data and you can send the data over to, say, the nearby clinic or hospital to inform the healthcare team that, someone actually has fallen. Now, obviously, the implementation, the rollout requires a more logistic thought, but the technology is there. Another good example is I work with a lot of seniors with dementia, Alzheimer's disease. And we know that in particular, they are at risk for some of the things that can be quite dangerous. One example will be wandering behavior, leaving their home, say in the middle of the night, in the middle of winter, that can be very treacherous. Well, we now actually have technology that can help us to try to track and know whereabouts our seniors have gone. In the old days, people talk about using the wandering registry, which can still be done, a special medical alert bracelet that when the wandering person is found, someone can inform the police and try to track that paper record. Well, guess what? We now have GPS devices, whether it is a chip, a smartphone, or whatever. So identifying, for family members, to identify someone who has been wandering away really can improve the safety of those who are prone to wandering behavior. So these are only 2 examples, and I think the sky is the limit. There's so much that we can do in terms of really improving that experience, that aging experience for everybody.
So, as I'm sure you're heavily involved in this, Roger, Faculty of Medicine is refreshing their strategic plan. A lot of exciting things coming up. What are you excited about to see in that new strategic plan as it lays the groundwork for the next 5 years?
Absolutely. Well, I have to say that in our first strategic plan in the UBC Faculty of Medicine, Building the Future, we have accomplished a lot in the past 5 years. I was doing a quick counting in terms of the projects and initiatives within the education pillar itself. Over the past 5 years, I am tremendously grateful for everybody in the province who has been supportive of these faculty of medicine education initiatives. We have either completed or have them underway 54 different projects, and that's huge. And obviously, our star example is the creation of the School of Biomedical Engineering. It's a really phenomenal achievement, but also all the programming that comes along with it, the development of the bachelor program, for example, in BME. When we move into the next 5 years, and we are so excited that we're moving into the next 5 years, we're doing a refresh of the strategic plan. And in this particular piece, again, I can speak about education as the vice dean there, we are really looking at building upon the strengths that we have achieved throughout the first 5 years of the strat plan, and how do we fine-tune and tweak our objectives, our strategies, in order to best fulfill our mandate of social accountability. And I have to say, one of the first things that we'll be doing is really looking at all the programs from a people perspective. Now, we have always been people-focused, but I think to really look at how do we best improve that experience, that educational experience, both for our students and learners, but also for our staff and faculty members. I think that's really important. Something that all of us have heard a lot about is about diversity. I believe, actually, diversity is the reality. Inclusion is our choice and our commitment. That is where I would like to see the education programs within the Faculty of Medicine go, whether it is about attracting the prospective learner from our K-12 education system so that they can start thinking about health and medicine and BME, for example, to our applicants who apply to our various professional programs and other structural programs, to our learners and students who are currently in program, but to our graduates as well. We've done a lot of work, for example, trying to support our Indigenous students, and we are building upon the initial successes that we have in terms of engaging the Indigenous students, as well as walking along with them along their pathways in medicine and in health. We have also started doing a lot of work looking at other groupings, other students and learners who historically may be underrepresented within our programs. And that actually would allow us the opportunity to really work with Black students, to work with students of color, to work with students who live with chronic conditions and disabilities, students who have different life preferences, students who actually are LGBTQ2S+, and students from rural and remote, many, many opportunities. That's going to be a huge focus in the next 5 years. In addition to that, I think our continual striving for excellence in our various educational programs. We are going to do this in a cross-sectoral approach. I mean, biomedical engineering is a good example, that we have a crossover between engineering and medicine and health. And I think we need to go beyond that. We need to cross over with business, for example. Full disclosure, I actually have an accounting background, so I have executive management training. So I myself I'm an example of a cross-sectoral product, if you think about this way. So I think that is the way to go.
Quick question for you. This is being, communications. This is a really important thing for me. You are so active on social media, and you provide like tons of interviews and that sort of thing. Is this something that you would like to see more scientists pursuing, and like basically just getting scientists to step out into the public forum? And is there a way that you think we could support more of that?
Absolutely. What I have to say, the approach that I've been using is not necessarily considered as a traditional approach by many
Yeah.
scientists, but I look at it as an opportunity to really do outreach with population, with our society. Going back to that social accountability mandate, I have to figure out ways of how do I transfer the knowledge. This is about KT, it's about knowledge transfer. And let's face it, the knowledge that we have for all of us as professionals, that knowledge can be very nuanced. It can be, well, let me give you an example. You spoke about my TED Talk. I did that, now this is 3 years ago now. When I did it, I found myself giving the messaging over and over again. I felt like, oh geez, am I like a broken record player in a clinic, in a hospital, giving the same messaging, trying to help support seniors aging in place, living at home, without necessarily moving into different environments. And then I thought, okay, I need to really get the message out there through a different platform so that there is better penetration of that message. That KT, that knowledge transfer, has to be more effective. And then I thought, okay, I'll try the TED Talk platform. Well, I have to say, it was a lot of blood, sweat, and tears afterwards, because even as someone who has done a lot of public speaking, a lot of keynote speeches, the TED Talk is a very different thing. So I spent a lot of time, working on my messaging and my talk and the delivery, and it was very well received. I'm actually very humbled and honored that the TED Talk website actually has curated it into the main site. So it started with a TEDx, but then it's now part of a real TED Talk. So is actually quite amazing. But that's one example. I think when you look at social media, when you look at various types of media channels, this is how our population, our members of society are taking in the messaging. If we don't get there, if we don't get our messaging out there, someone else will create the messaging and fill the space. And those created messages may not exactly be aligned with the science or the knowledge that we have based on evidence. So trying to get evidence-based information and knowledge in a easy to digest and a straightforward manner is, I think, something that all of us as scientists have to do. And if we don't do it, we haven't really fulfilled that mandate of transferring the knowledge. Knowledge transfer means more than our publication in peer-reviewed journals with high impact factors. We all do that. But in addition, I think we need to get that extra step up.
Let's make science go viral.
Yeah. Absolutely.
That's great. Maybe I'll ask one other question and then we can do a couple light ones, Roger, because we're approaching time and I know you're super busy. So, and I may be wrong on this, but it appears that we are sort of at a shortage of clinicians across the province. I come from Ontario. I moved here 3 years ago for this role that I'm in. And if that's correct, do you think that's a solution to that might be increasing the number of MD seats? Or is there a fine threshold, then you can really educate the students well? What's your thought on that and strategies that we can face that going forward?
Well, that question itself, we can go for another hour or longer. But without that time, what I can say is when you look at UBC in the Faculty of Medicine, and specifically, let's say you look at the MD program, which I think is what you're referring to. For the Doctor of Medicine program, the program has expanded significantly over the past 15 years, and we've distributed in a way that I've described throughout the province. It's a province-wide operation. There have been, I think the number of doctors that have been produced ever since the expansion and distribution of medical school, being the only medical school in the province, we have produced over 300% of the number of graduates over the past number of years, and that's huge. That's like a significant number. That said, I think there is the issue of when we finish training our doctors, people make their own choices in terms of where to practice and what to practice in. So that freedom of choice is really something that we all understand and we respect. Now, we recognize that while medical education is an important factor, and it is very important, is part of the pipeline in producing the professionals, there are other factors that influence a doctor's choice in terms of where they practice. So, for example, there are many personal factors, gainful employment for the spouse, if there are children involved, finding adequate schooling for the children. And also there are societal factors, whether there are initiatives within the community that will support the newly trained doctor to practice there. So I think what we need to do really is we absolutely need to go to where the need is the most. So for example, our Northern Medical Program, training doctors in the North, for the North and for the rural and remote, is something that have worked out really, really well. I think we need to continue to work on that. And similarly, when we look at our distributed campuses, on Vancouver Island and in the interior, I think we absolutely need to build upon those. When you look at the Lower Mainland, we have been doing a huge amount of work trying to train doctors for not just in the Vancouver area, but also for the Fraser Valley. And we have been continuing to send a lot of our students and residents going through the experience there, because we know that where you train them, they tend to stay to practice. Very happy to share with you that most recently in the UBC Senate, we now have full approval of a program that is called the Fraser Medical Cohort. It's really an important opportunity whereby students from the Fraser Valley can actually elect to do all of their core medical rotations in year 3 when they come into the medical program. And we are better supporting our students in the Fraser Valley, again, supporting them so that they eventually can practice in the Fraser Valley. We know that medical education is a continuum. It starts actually from medical school or even earlier. I talk about that K-12 education system, recruitment importance, but it then goes through residency, goes through fellowship, some of them, and then practice. It's a continuum that we are committed to supporting.
That's great. Thank you so much, Roger. Miguel?
Yeah, so by the way, I just wanted to say the northern training doctors for the North, that's fantastic. That's where I'm from, up in the Fort St. John to Prince George area, and I'm pretty sure my family has reaped the benefits of that. So that's a great program. So one quick light question, which is, how do you find the time for anything with all of this on your plate? You obviously got a lot going on. Like, do you still have time for research?
I do. So I thought when you asked the question that you're trying to talk about my personal life outside, and yes, I do have a personal life.
Yeah, good, yeah.
We can talk about that. So the research that I do, again, mainly are in 2 areas. So one area is acute care geriatrics, as I mentioned. So ACE units, acute care for elders units. How do we provide the best possible hospital care for older adults when they get ill? That also is the area whereby I have received a recognition from the Canadian Geriatric Society. So I actually won the top national award in geriatrics in Canada. And then my recent appointment to the Order of Canada also have a citation of that particular piece of work. The other major area of research is in medical education. So in medical education, my main work is about innovation in curriculum and implementation. So I actually, for example, I am the national author of the Royal College of Physicians and Surgeons of Canada textbook on teaching quality improvement in residency education. So CQI in residency, which is a very novel kind of curriculum. Now, I know that we also have similar requirements in other professional programs, such as in engineering, but the medicine one, the Canadian national textbook is written by me. And in 2020, I'm also very humbled that I won the top medical education award from the Royal College of Physicians and Surgeons of Canada. It's the Duncan Graham Award, and it's a big deal. Is basically a reflection and a recognition of all the education work that I've done in the medical and health field. Now, just very quickly, I actually, I'm a swimmer. So I used to, before the pandemic anyways, I used to swim 6 days a week. So, and typically at the end of the day. So a lot of that relaxation, that mindfulness piece is really important because I believe well-being is so important for all of us, in particular during COVID. One of the things that I found very early on was actually I developed the Resident Wellness Office program at UBC in the Faculty of Medicine, one of the first premier well-being program for resident doctors in training in Canada. And basically that was developed at a time before well-being was even being recognized as something critical for organizations.
That's great, Roger. So we'll end it with one lighter question. Is there one piece of advice that you would offer to your younger self now that you've been through such a ordeal and there's so much on your plate?
Absolutely. I think what I would say is the importance of compassion. I think be compassionate. Be compassionate not only to people whom we serve, but be compassionate to yourself. And I think that that's really important. It's something that compassion is a significant motivation, a driver that gets all of us to do what we love to do. I have to say this past year, as during pandemic times have been very tough for many people, for all of us. It has affected us in different ways. And I think sticking with that compassion for others and for ourselves is going to be so important as we continue this journey through the pandemic times.
Well said. That's a great way to wrap everything up. And again, it was a pleasure getting to know you. As you said, we probably could talk longer with you. And maybe we will have you for another episode down the road because you do a lot of interesting and fascinating work. Again, thank you so much for being with us today.
No, thank you so much. Yeah, no, it's been very fun and glad to be sharing.